Ecuador is a beautiful country on the west coast of South America. If you wanted to visit Ecuador, the flight would take 10 hours and 46 minutes from Lexington. The population is over 17 million people as of this month. The average salary earned in Ecuador is $45,204, which is almost half of the United States average salary of $81,700. Most of the population is covered by the country's public health system. There are two subsystems in Ecuador, which include private and public systems. The private systems are available to citizens at an extra cost, while the public system is funded through Social Security, also known as IESS.
Funding for services is a vital aspect of all healthcare systems in the world. In Ecuador, public insurance is paid for by the state government, and all private services are financed through the public sector, buying out care services from private health insurers and prepaid medical insurance. As a result, Ecuadorians pay much less for health care services. Monthly premiums average around $70 per month in Ecuador, in contrast to the monthly premium of around $1,200 in America.
This graph represents the percentage of Ecuador's population covered by insurance versus the GDP per capita in 2011. Ecuador had a GDP of about $10,000 and over 20% of the population was covered. In 2017, a new law was passed requiring individuals over the age of 65 to obtain health insurance and would no longer allow the denial of services. As a result, funding for each service increased. Overall, the healthcare system in Ecuador has vastly improved throughout the last 10 years, offering higher quality and lower cost services due to the process of funding.
Ecuador has undergone rapid growth throughout the last 20 years in many aspects, including their national system of higher education. There are 19 universities in Ecuador, and only 12 of those have postgraduate clinical training programs as of 2009. Medical students have 5 options within this postgraduate clinical training, including clinical specialization, higher diploma, course specialization, master's degree, and PhD degrees.
The picture on the screen is one of the 19 universities in Ecuador. This is the main building of the Central University of Ecuador, located in Ecuador's capital, Quito. There is a mix of public, private self-financed, and private co-financed between the 12 universities. Medical school is required to become a physician, so it is important for any student pursuing a career in the medical field to attend one of the postgraduate programs required. This may not always be feasible, however, due to limited resources. Prior to 2009, there weren't many options for medical schools in Ecuador, so students pursuing a career in healthcare had to achieve these goals by training in other countries, which many students still do to this day. Ecuador also has a community health workers training program used by the Ministry of Public Health. This program trains individuals in preventative healthcare, maternal and child healthcare, first aid, and basic illnesses. Individuals who participate in this training program can't fulfill the role of a medical professional, but they can provide basic healthcare services. This picture was taken during one of the training classes offered by the Ministry of Public Health.
The culture in Ecuador is a very old and diverse culture. Unsurprisingly, the culture experienced here in Ecuador has many far-reaching effects on the way healthcare is practiced and accessed.
One of the biggest ways Ecuador healthcare differs from that of the United States is by the prevalence of more traditional healing methods. These traditional healers are called curanderas, and they utilize practices passed down through their culture to treat illnesses. This form of traditional medicine uses many different herbs and plants to formulate natural remedies. A lot of the older population mistrust the modern medicine available in Ecuador, which results in many Ecuadorians avoiding the clinics and hospitals Ecuador has to offer. Even though Ecuador has high-quality healthcare, this disconnect between traditional healing practices and Western medicine has led to poor health outcomes. There has also been a divide concerning the indigenous people of Ecuador and their access to healthcare. Unfortunately, there is still discrimination against this group, which has led to a lack of healthcare that is suitable for the culture practiced by the indigenous people. Because of this discrimination, the indigenous people of Ecuador experience worse health outcomes than the rest of the population.
The life expectancy in Ecuador as of 2016 was 74 for males and 78 for females, which is pretty impressive considering that Ecuador is still considered a developing country. The death rate as of 2014 was 6 per 1,000 people, and the fertility rate in Ecuador actually dropped from 3.26 in 2000 to 2.29 in 2015. Some of the most common diseases in Ecuador are hepatitis A, typhoid fever, and dengue fever.
Heart disease is the number one cause of death as of 2019, followed by kidney disease and stroke in Ecuador. Based on overall efficiency of the healthcare system, the WHO ranked Ecuador 111th in comparison to all of its member states. Indigenous, low-income, and rural households are particularly limited in their ability to access healthcare services in Ecuador. Unfortunately, Indigenous people face regional discrimination in the healthcare needs that they can access. Along with this, the geographical location of citizens creates a disparity in the access to healthcare for these more secluded communities of eastern Ecuador. However, access to health services is guaranteed for all citizens by the Social Security institutes.
As of 2017, an estimated 8.7% of the country does live in poverty. Despite some of these impoverished conditions, most of the country and the citizens of Ecuador do have access to healthcare. Some of the bigger cities in particular, such as the Ecuadorian capital of Quito, provide excellent medical care for their citizens.
We will now hear from an interview with our friend Lauren Cravens.
Honestly, contrary to popular belief, America's healthcare kind of sucks compared to Ecuador's healthcare as far as cost goes. I know that's one thing that my mom has always talked about, because things that were basic coverages in Ecuador, she has to pay a lot more for here in America. So I would say that's the main difference that I've noticed. Yeah, so even though I just talked about the modern healthcare in Ecuador that my mom has experienced, I will say that because of the rich culture that is centered around healers and traditional types of medicine like that, those types of alternative medicine do still exist a lot more in Ecuador than I see them in America. And I've heard many stories from my mom about my ancestors or family friends seeing alternative medicine practitioners and seeing healers instead of visiting clinics and doing modern medicine.
As you can see, Ecuador's healthcare system is far more advanced than other developing countries. Hopefully this video taught you something new about a country that you aren't all that familiar with. We really enjoyed making this for you. Thanks for watching. Bye guys!